Today I'm talking about endometriosis, a painful disease in which the cells that line the uterus are found in places outside the uterus. This can be found in so many parts of the body, but they are mostly found in the fallopian tubes, in the ovaries, in the abdomen. And what happens is that when the body is going through the menstrual cycle, that is, the woman is menstruating, wherever these cells are located, where this tissue is located, they'll be menstruating too. Unfortunately, the blood doesn't have anywhere to go. There'll be thickening, there'll be shedding, there'll be bleeding of these cells where they're located. The consequence of this is that there'll be pain, there can be cyst formation, that is collection of fluid. There can be even infection in some cases. There can be mass, like a tumor, we call it endometrioma. The blood cells die. They can form fibrous tissues that can make organs to join together. Imagine your intestine joining to your bladder, or your bladder joining to your uterus, or your intestine joining together to your stomach. These are complications that can happen. So what are the symptoms? Number one is excessive pain, during menses especially. There could be heavy bleeding, cramping during sexual intercourse. After sexual intercourse, there will be pain. There may be other things like nausea, there will be constipation, bloating, there will be fatigue, diarrhea. Most of these symptoms depending on where these tissues are located. As for the cause of endometriosis, there are so many theories. When the woman had the baby and the baby was developing, the hormones put the cells in the wrong place. So many things can cause it. But what are the risk factors? Number one, if the person has a mother, sister, or auntie, that is a blood relative that has it, likely that you have it. Number two, the person has a low body mass index. Number three, people that at the age of 35, 36, they've not had any pregnancy, either miscarriage or anything. People that had any menarche, that is, they started menses around 8 years, 7 years. And people that have late menopause, that is, their menopause goes as far as 56, 57. People that have short menstrual cycle, especially people that have menstrual cycle less than 27 days, and people that bleed for more than 7 days, they are of higher risk of having endometriosis. So how is it diagnosed? The doctor wants to ask your history. Then you do a pelvic examination. You can do an ultrasound. If your ultrasound is not enough, you can go and do an MRI. And finally, you can do a laparoscopy that he wants to see where the endometriosis is. So how do you treat it? So many treatments are available. Number one, pain relief. You want to relieve the pain. Number two, you want to use hormone therapy. If you give some hormones, it can help to control the menses and also control where the cells are located, especially those contraceptive hormones. Also, we can do conservative surgery when we go there using our camera and this will remove where the cells are located, where they are not supposed to be. The uterus and the ovaries can be removed. This will make the person stop producing hormones that would make endometriosis worse. But please note, when your ovaries are removed, it pushes the person to menopause, which has some complications. I hope I've been able to help with endometriosis. Thank you very much. I'll see you in the next one.